Hi, I'm Susan Westman, licensed vocational nurse, and this is New Horizons Chronic Care Management. I am also a freelance writer. This podcast is a different one tonight. I won't be going over any information other than what I want to explain is what I'm going to be doing. The topic tonight is in education for chronic care patients for nursing homes and for home health. In my years as a home health nurse, I had to do a lot of teaching to make sure that patients understood their diagnosis, their condition, and their medications, as well as to reconcile those medications. I would almost always see where previous nurses had taught XYZ to the patient. However, the list taught was long and difficult. And I am quite sure that that whole list, the patient did not understand most of what they were told, let alone remember it all, later on, because it was just too long and too complicated, especially if you have patients with any kind of Alzheimer's. Home health nurses use templates to teach with, and those templates are long. There's no way for a chronic care patient or a home health nurse or a home health patient to understand a full paragraph about their condition, and let alone a dozen meds or more, and know what they are, even if she goes over them. As an experienced nurse, I know that most nurses don't explain all the information included in that template. There's just too much information. We're only really supposed to do a little at a time. The problem with teaching all of that information, if they really are, from a template, is that it cannot be retaught. If they put 100% understanding, that means that topic is done. There's nothing more that can be done. And Medicaid and Medicare will not allow that topic to be discussed again. They've got 100%. That means they have 100% understanding, and that's it. Go on to the next topic. But yet, when that patient, you ask them, well, what did you learn from that? And they go blank. They don't have any idea. And I've had that happen many times. I've asked my patient, well, tell me one thing you remember about XYZ. They couldn't. Well, tell me one thing about your medication. What does it do? They couldn't. And yet it shows 100% understanding. And that meant I couldn't go over it again. They don't allow a double take on that. Once it's 100%, it's done. Choose something else. So I want to fix that. I want to be able to help nurses that come on to know what they can teach on and what they need to teach on. Now you might wonder, well, how will I know? I don't know who the patient is. I don't really have to know. I've done enough home health. I know enough chronic illnesses. I can go over a whole bunch of chronic illnesses and their medications, what goes with that medication, what goes with what, to be able to teach on it. I've been an LVN for 18 years, and I've done a lot of home health. I've done hospital. I've been in the prisons. I have a lot of experience with that to know what I need to bring up and if I even hit close to it. So I will be able to know pretty much what I need to hit each week, twice a week, so the nurse knows. Now she's going to be teaching, they're going to be teaching on something in that file. And I'm not going to know what it is because I'm not going to have access to that file. But I can pretty much guess. And even if I don't get exactly what their condition is, they're still going to learn something from that because the medications that are involved. Most patients, home health patients, as well as nursing home patients, are pretty much on the same medications for heart, for blood pressure, CHF, COPD, and a bunch of other stuff. So it wouldn't be real too hard for me to know what to teach on each week. And this works both ways for the nurses and for the patients. That way, the nurse can get a good idea of what to be teaching, and it helps them to help the patient. And the patient, if they hopefully see my podcasting, they're going to get that education as well. So whatever the nurse has told them, they will also find backup in my podcast, and vice versa. It helps you nurses with your teaching with the patients, and it helps the patients to help them get a better understanding, because I don't have to worry about whether or not I've told them the same thing over again. I can go over it every week if I want to, because I'm not their nurse. So if I want to reinforce some teaching that they need, or medications that they need to know about, I can do that. The nurses can't. Once they've taught it, and they've given how much, if they only give a 75% understanding, then they're good to give it one more time if they need to. They can go back and they can refresh. But I've seen nurses that have given 100% understanding. I used to, because I didn't really understand that once I do 100%, the Medicare says, well, you're done with that, move on. Another topic. So when I was informed that I needed to not give 100%, do a 50, do a 65, something that allows me to reinforce it. Because I can't even really go back and reinforce it if they give 100%. So nurses have to be careful when they go to home health. They have to be careful how much understanding they give that patient. Do they understand it really well? If they really do, then at the end of that visit, ask them, tell me again, what is this for? See how much they do remember. Quiz them before you leave. That way you can document it. Well, they fully understood it when I left. I hope they understand it next week when I come back. Because that's one of the things I always did. When I went back to the home, I would go back and say, what do you remember about this one? What do you remember about this disease? Sometimes I could kind of get there, but not really fully understand it. But at least I knew they were listening. I knew they got some of it. But I still had to use something else. And every time we go to a patient's house, we always had to know, what did they teach before? That means, do I reinforce it? Or do I move on and do something else? I tried to move on and do something else. I didn't want to keep hammering the same thing over and over again. So with my going over teaching for home health and chronic care patients, wherever they are, this helps them maybe understand more of what the nurse has told them, reinforces it, and it helps the medications with the diagnosis with the nurse who's trying to help that person understand what they are supposed to have. I can be kind of the backup person, the reinforcement person, basically. Because if you give them too much information, they won't remember it. That I've had all the time. You have to break it down to where you get just enough where they're going to understand maybe one small thing. And if they can understand one small thing, then you move on to the next small thing. But you don't give it to them in big lumps. Patients don't remember that well on that. My episodes will be on Mondays and Fridays. Now, this is late Sunday night, almost Monday morning. I'm doing a late one tonight. But this is when I will be doing. Each of these episodes will be on Mondays and Fridays. I don't know if it'll be this late or this early in the future, but I'll be going over different things that for the week that I believe that nurses will be going over with their patients. And hopefully it will benefit the nurses, and it'll benefit the patients, because they have to see the podcast, which is something I'm going to have to work on and find a way to get this information to them. And in addition to those, my podcasts and my episodes, I also do a devotional, because my understanding is, and I've been told by several different people, that they also like a devotion. They like, scripture, and they like to be prayed for. And that will be one of the things in my episodes that I will be adding to this. They will be getting some scripture as a devotional to help them with whatever it is they're dealing with, so they know that someone's praying for them, whether it's anxiety, whether it's stress, whether it's whether it's pain, whatever their situation might be. No, most nurses, in fact, I don't know if any nurses, pray for the patients before they leave. I tried to do that, and I was pretty successful with it, because I always ask for permission to do that. But patients do like that. They like to know that you're going to pray for them. So in my podcast, in my episodes, that's what I do. At the end of the teaching, I like to do a scripture, explain it so they understand what that scripture means, so I understand it too, and a prayer time, a short prayer time for them. So that will be part of the benefit of doing this kind of podcast. I hope that will help you. I hope that this podcast is not just for nurses. This podcast is meant and intended to be for educating anyone with a chronic illness that they need more information on, they need more guidance on, and for home health. Any home health patients out there that are cognitive enough to understand, and if they are able to find the podcast, someone can help them find the podcast and do it that way. Or even nurses who are working can help them find it and watch it with them. Who knows? They probably get lucky with that. So this podcast is not just nursing, not just for nurses. It is to help the nurses with the patients, help the patients with the training that they get, teaching they get from the nurses. It supports it. It reinforces it. Because I didn't want to just have it just for nurses. I want patients to understand it as well. So I hope that you will find this podcast, New Horizons Chronic Care Management, teaching and understanding, useful for you and your patients, and worth watching. And if you do like to watch it, or you do get something out of it, I ask that you subscribe so that you will know when my next one is, which will be Monday and Friday. And it probably won't be this time of night, because I don't think you're going to want to get up and watch it. So that's all for tonight. Subscribe so you won't miss this. And if you can, let me know what you think. If you need to get something to me where I can help teach on, do so. Let me know, because I would really like to know. Thank you and good night.